think that people do have the option not to pay for it, and they don't pay for it because it's too expensive, and then they're just not covered. I mean, no one does anything about that.
I'm not talking about health insurance. I'm talking about like a life-threatening operation. If you go in and you're having a heart attack and it's pay the doctor's bill to have emergency surgery or die, you're going to have the emergency surgery. Not talking about health insurance, talking about that life and death situation. That's where people don't have a choice.
Okay.
Well, wouldn't you say that you're going to end up paying for someone else's hospital bill anyways if they don't, through our taxes, if they don't go ahead and pay for it themselves?
Well, at the rate that they're kind of, people are pushing right now, I mean, a lot of the, like, Hillary Clinton and a couple others of the Democrats are pushing for the nationalized health care system, which that's kind of what they want. I mean, they want the health care of everyone to be put on everyone else. But, I mean, there are very many fundamental problems with that, which stem, you know, from the quality of care given. Because if everyone is entitled to the same care, what is to motivate, you know, Dr. A, you know, from giving better service than Dr. B? I mean, if he has no more motivation, because if he's going to be paid the same to give a medical procedure to this person as he would to this person, I mean, he's not going to put any extra effort, whereas, you know, if it's a risky surgery and he was going to be paid a lot, he might put a lot more of himself and a lot more effort into making sure that procedure paid off for that person.
Absolutely. And coming back and looking at the quality of the health care that you're going to get, I think this is a viable analogy. If the government tomorrow suddenly declared that food was a universal human right and all human beings were entitled to 3 meals a day, and they passed legislation that said that everyone can, you can eat at any restaurant that you want, and no one can legally deny service to you, and the government will reimburse all restaurants at a flat rate of $5 per meal, perfectly reasonable to cover the basic cost of food. What do you think would happen to the quality of food service in the U.S.? Would you ever want to go out if you had to go to Chili's and you knew that they were only going to be reimbursed at a rate of $5 per meal? The quality would dive bomb. It's the same thing that we're looking at in a healthcare situation, and people think that it's going to be snap your fingers and everything's going to be magical and it's going to work, but it's the same situation, and there's this misnomer, there's this myth that nationalized healthcare is free, but it's not. We end up paying for it in our taxes, and you look at countries like Canada and France where nationalized healthcare is in place, and in a lot of cases their tax rates are 45–50%. So we're still paying for it in the end.
But along those same lines, what happens is, you know, like you said, when it's standardized and people are paying that $5, you know, or the government is reimbursing them $5 for that meal, they're going to be reimbursed no matter what. So even if they give a meal that's worth 50 cents, they're still going to be given $5.
Right, it goes both ways.
And so it's actually going to encourage them to give less because that means they make more.
So the quality decreases.
So,
yeah.
All right, well, we're going to take a quick break, but if you'd like to be on our show, if you have any questions or comments, please call us at 213-743-2822 or email us at platforum@trojanvision.com, or catch us streaming live on the web at www.trojanvision.com. We're going to take a quick break, but when we're coming back, we're talking about President Bush's recent veto of federal health care for children. Stay tuned.
Motorcycle Club. Everything must go. Ghostly ghouls. Don't look at that, Teddy. Body piercing. Ouch.
Everyday moments can become teaching moments because learning starts long before school does. Give your child the start they need at bornlearning.org.
This is a man who almost learned to walk at a rehab center that almost got built by people who almost gave money. Almost gave. How good is almost giving? About as good as almost walking.
Welcome back to Platform. President Bush recently vetoed a bill that attempted to bring government coverage for children that are from poor backgrounds. Now, what do you think? Do you agree with his veto?
I completely agree with his veto. I think that we do need something to help the impoverished with health care, but I don't think this bill
goes about the right way of doing it, because it does allow families with an income of up to $83,000 to receive this health care. There's a grandfather clause set in New York that the Democrats have been trying to put down, but it's there. And also it raises up the taxes of the whole nation. I just think there's so many flaws that outweigh the good aspects of it. What do you think?
I agree with his veto of the bill, absolutely. Like you said, $80,000 was the limit, which if families are making $80,000 a year, with some exceptions, obviously, but as a general rule, they can afford their own health insurance, and also that it covers children up to age 26, which is a little bit excessive to classify children. And now the tax itself actually wasn't on the standard consumer, it was on cigarettes. It was about 60 cents a pack for cigarettes, which, if you're going to tax something, I'd rather see it go there, but at the same time, taxes on cigarettes have already doubled the price of cigarettes in the past, 6 years. So you have to draw a reasonable line on where you continue to tax that. What the problem with George Bush's response to this bill, though, was that he didn't suggest an alternative. He said, we believe that we should help those individuals find private insurance. He didn't elaborate how he was going to do that. And what's unique about this bill is it has such a large amount of bipartisan support, but that's because the authors of the bill have done something that a political maneuver, it's called the Tiny Tim syndrome, where they make a bill that aids children. So anyone taking a stance against that is seen as opposing children. They're Ebenezer Scrooge attacking poor little sick Tiny Tim. And so it's almost impossible for anyone to take a stance against this, because even if it's very reasoned and thought out, they're still attacked in the media. Oh, George Bush hates children. When that's not necessarily the case. The bill was not sound in its current form.
So do you think given time, he could come up with something more reasonable? I think everyone's just being a little hasty and condemning him again to this Tiny Tim, Garrett Hardin idea that we don't want to help the poor, but given time, he could have something up his sleeve, very soon.
Well, I think the bill was legitimately out there to help people, and, I think that it's unfortunate that things like this get shut down so early in their stages just because, of a few technicalities.
Yeah, perhaps if the bill was able to sit in Congress a little more and they had more, maybe if they had just spent more time revising it, they could have come up with something better. Because I think that, obviously, I think we can maybe all agree that there needs to be some type of reform.
Absolutely.
And
well, they actually can. It's back in the House, I believe, for the debate where it has to get a 2/3 majority to overrule George Bush's veto, which it's not going to get. But both sides have said that they're not willing to change their stance, so they're not willing to compromise. This isn't just George Bush not willing to compromise. It's both sides, and that's unfortunate because they still have a chance to work on this. I think that the fundamental problem with both sides here is that the Democrats are looking for a socialized health care solution, and the Republicans are looking for a purely free market solution. And I think that historically there's a lot of problems with both of those, and I think that the solution in the long term to benefit everyone is going to range with a compromise somewhere in between. You have to start looking at your stress points on the healthcare industry and identifying where that can be alleviated. You look at emergency rooms where you have people going in for strep throat and fevers and small things of that nature, and that's a huge amount of emergency room traffic that doesn't get paid for, that gets passed on to the taxpayer and the legitimate healthcare consumer. And you can alleviate things with this. CVS and Walgreens are making efforts with an initiative called Minute Clinic, and it's a for-profit idea that they're implementing. They've done it in 60 stores so far, and it's a small clinic in the back of their stores where a licensed nurse practitioner can diagnose small things like strep throat, fevers, prescribe antibiotics for between $30 and $60 per visit. So it provides an affordable healthcare option for people who aren't covered with health insurance to alleviate stress from emergency rooms. You have companies like Costco that are working on providing free generic prescriptions to individuals as a loss leader to get people in the store. So there's definitely efforts being made there, but the biggest thing, we have to get the free market working, and that's putting restrictions on the HMOs.
Well, President Bush called his veto of this bill a philosophical issue. Do you think that it really is a philosophical issue, or is it more of a moral one?
It's a hard question. I think it's political more than anything. I don't think that either side right now is going for the philosophical or moral behind it. I think that it's kind of, they're jockeying to see who can make the other side look worse in the least amount of time. And,